I want from each. Yes? Now let's start with viral hepatitis. Once I will ask about viral hepatitis, what you will tell me first? Viruses. Yes? What are they? A, B, C, D, E, acute, B, C, D. So you know that you have acute and chronic. So then number 2 you will speak about acute. What does it mean acute? It's less than 6 months duration. And you will tell me all the viruses. Now histologically, remember, what do I see? Always remember, acute hepatitis, please. Remember from last year, the reaction of the virus or alcoholic, etc. in acute form starts with ballooning degeneration. Yes, or hydropic degeneration, water accumulation, from last year. Okay? So number 1, what you tell me, ballooning. These cells, when they will die, what it will give me? Apoptosis. What it is called in acute viral consequence. Yes? Remember, apoptosis is not necrosis, it's a scattered. Yeah, you will see deep eosinophilic cytoplasm with dark particles. Okay? Number 3, what do you think will come? Inflammation. It will be where? It will be chronic here, around portal areas, in preparation for the chronic form. Yes? Remember, because you will speak for the chronic. Number 4, with all these problems in hepatocytes, etc., what I will see? Cholestasis. The bile secretion will be affected. Okay? Now I come to the third one, which is chronic. What is chronic? It's more than 6 months duration. What are the 2 types of or is persistent and active? What is persistent? In the portal tract, active starts to split in the hepatocytes around. Questions? Is it okay? Number 2, alcohol. What does it mean, alcohol? What are the stages? The first stage, tell me, what is it? Tell me, fatty. What does it mean, fatty? Thank you. I will bring all this. Is that not right? Okay. So number 1 is fatty. What does it mean? Microscopically, grossly, tell me. Big, yellow, greasy, more than 80-90% of the cells are transformed into adipocytes. Remember, in future, in your exams or tests, when you see scattered adipocytes, don't write fatty. Fatty must be all, because fatty change is just a change like the hydropic to any extra stimulus that destroys the hepatocyte. Okay, tries to destroy the hepatocyte. Okay, so fatty, 80-90%. It starts microvesicular and then it becomes macrovesicular. This is number 1. Now, this is if a patient is chronically alcoholic, which means everyday drinks. A patient, okay, that has fatty change, or a patient that never drinks alcohol, but suddenly they drink a big amount of alcohol, what I will see? Alcoholic hepatitis. Okay? Again, that's important. So the first step, chronic drinking alcohol will take to fatty change. Now, a patient that has fatty change, or a patient never drinks alcohol, but both they took a very big amount of alcohol suddenly, okay? And sudden, what it will be? Acute. So alcoholic hepatitis is acute. Okay? Any acute, what I will see histologically, start. Hydropic ballooning. Here they are called myeloid bodies. Here I have neutrophils. So, and I will have a scattered fatty change also. Okay? Now this alcoholic hepatitis that is not treated or it is very severe and fatty, where they will move? Cirrhosis. Okay? That's what I want from alcohol. So tell me quickly, what I will see now if I will ask you, speak about alcoholic hepatitis. Number one, fatty change. What does it mean? More than 80-90% transformed, yellow, greasy, big. Yes? Now, what is alcoholic hepatitis? A big amount of alcohol. What it will be? It is acute. So what I will see? Ballooning degeneration, Mallory, and neutrophils. Okay? Both the end stage, they are going to cirrhosis. Okay? Any questions? No? Wow. Metabolic disease. These are small questions. What is Wilson disease? What you will tell me? Copper metabolism. What are the pathological changes of the liver? Fatty change. Chronic hepatitis, micronodular cirrhosis. That's enough for me. Yes? Hemochromatosis. What is it? Iron. I have hereditary or secondary. What's the changes? Micronodular cirrhosis and hepatocellular carcinoma. Alpha-1 antitrypsin, the same. Yeah? Reyes syndrome, some viral infections in young children. And it can cause fatty change and cerebral edema. And the last one, non-alcoholic fatty liver, diabetes mellitus. That's it. Okay? It's the same. Steatosis, I have steatohepatitis, and then cirrhosis. Okay? Now, before I move, any questions? No. Now, the question will come like this, the next one. This,
Nutmeg level.
and I will put this. Yes? And stop. First, tell me diagnosis. Chronic passive congestion of the liver. Once you tell me this, I will ask what does it mean passive?
Right heart failure.
The second question will be, what are these dark and what are these pale in gross? Dark is
Blood.
hemorrhage and pale is normal liver. The second one, I will tell you what is dark. You tell me normal hepatocytes surrounding portal areas. And what is pale? These are coagulated necrosis surrounding central vein. That's it. Now, what I want you to remember, and I will be very upset when you don't remember. In the central part, okay, I have right heart failure. I have congestion. I have hypoxia. Okay, now, from there, I want the words. Hypoxia means ischemia, means infarction, means coagulative necrosis, means shadow of the cells, means pain. Okay? This is from last year, but you will put it this year. Okay, again. So what is this pale area? All right, you will tell me. I have right heart failure, I have congestion of the central vein, I have hypoxia, ischemia, infarction, coagulative necrosis. Yes? Means shadow of the cell and no nucleus. Now, I will add hemorrhage also because the congestion, chronic congestion will cause this hemorrhage in the tissue. Any questions? So this is one question also. Tell me, if you want me to explain again? You want? No? Anyone, don't be shy. I explain it now happily, but I will be very sad if you don't answer in the control. So tell me. Okay? Now. Liver is hemangioma, hepatocellular adenoma, what's the cause? You tell me. Pills? Hepatocellular carcinoma, what are the main causes? This is, I will ask with cirrhosis. Yes? You can tell me alpha toxin, cirrhosis, alcohol, okay? 3 or 4 causes. Yes? have glandular structures also, all right? Look at the glandular, okay? Look at here, how they are between the fibrous capsule. Even here, the fibrous tissue has entered between the lobules, so this is carcinoma. The fibrous capsule must surround it completely in order to say, look at this, they are between the fibrous tissue. This is invasion. Yeah? This is again, never any fibrous tissue between hepatocytes. There will be complete circulation for cirrhosis. Any questions? Metastatic, we know that liver is a site you will study in future. For any tumor, they just, one of the first checks are sonograph to the liver because it is a favorite site for metastasis. Okay, any questions? No? Shall I start? I will take attendance and I will start.